Hello, welcome to Let's Talk Cancer by the Union for International Cancer Control, an organisation that unites and supports the cancer community to reduce the global cancer burden. I'm Kerry Adams and I'm the CEO of the UITC based here in Geneva, Switzerland. Join us as we discuss topics most relevant to the cancer community. Today, we have the pleasure of talking about why cancer control is so important integrated into universal health coverage. Universal health coverage means that all people can benefit from quality health services where and when they need them without suffering financial hardship. But at least half the world's population still do not have access to the full range of essential health services, including cancer care and treatment. And the cost of cancer treatment and care may push many patients and their families into poverty or further into poverty due to out-of-pocket spending. How can we integrate national cancer control into universal health coverage planning? How can we improve access to care for marginalised communities? And what lessons can we learn from other nations? With us today to discuss all of this is Dr. Batmunkh, CEO of the National Cancer Council of Mongolia, and it's a pleasure to talk to her.
Good afternoon, Kerry. Thank you for inviting for this podcast.
So we're talking about UHC and we're talking about cancer control. So drawing from your experience in Mongolia, how can a country really develop resource-efficient national cancer control plans and improve access to care for marginalised communities, particularly given the geography that you've got in your country? And how can this be integrated into a commitment to universal health coverage and the planning for that?
Before 1990s, we had centralized and hierarchical healthcare system established during socialist time, and the heavily centralized government structure proved inadequate to address the needs of the different populations, and therefore two major government reforms initiated in early 1990s were the mobilization of additional financial resources through establishing a health insurance system and shifting priorities towards primary health care. And this new system for the country has been shaped on principles of equity and social justice, where a package of essential healthcare services is provided free of charge to everyone at the primary level, and complementary healthcare services are covered by the health insurance system. And currently, provisions for universal, equally accessible, quality, and free of charge primary healthcare is stipulated within Mongolian law. And the essential service package has been continuously expanded and currently includes healthcare for neonates, children, adolescents, women of reproductive age, elderly adults, covers communicable as well as non-communicable diseases, emergency care, nursing, public health services, and over last year with COVID pandemic, COVID screening and treatment. And with regards to cancer care, diagnosis and treatment of all types of cancer is covered by the government budget and national health insurance. So it includes the whole continuum of cancer care, chemotherapy, radiotherapy, surgery, cancer prevention and screening programs.
I do understand that in Mongolia, one of the biggest challenges you face is that so many people present their cancer at a late stage. I think it's something like 70%, which is not uncommon across many low and middle income countries. We all know that late presentation not only reduces chances of survival, but also it's very expensive to try to treat people with a late stage cancer. So what's been done by the government of Mongolia and the National Cancer Council to try and address that really critical problem that so many countries face?
Despite good policies in place in our country, cancer is still the second leading cause of mortality, and the number of cancer cases diagnosed at late stage 3 and 4, as you mentioned, are still remaining the same as we had 30 years ago. We need to do a lot of work and focus on the early screening and prevention programs. So 60% of cancer in Mongolia are the types of cancer that can be prevented and early detected through screening programs such as cervical cancer, liver, stomach, and esophageal cancers. Mongolia started cervical and breast cancer screening program in 2012 with Millennium Development Challenge funding. and all women from 30 to 60 years of age obliged for cervical cancer and breast cancer screening programs every 3 years. Besides this regular screening program, we have some of the screenings are included in the health law for different age group because of the high burden of liver cancer. People above 40 years can have a regular hepatitis B and C infection marker ultrasound for liver abnormalities once in a year. And people below 40 years have early detection of stomach and esophageal cancer. And people above 50 years can have lung disease early detection once a year and bowel cancer early detection every 2 years. And from the statistic, we can see the screening rate is around 40% nationwide, which is not really good progress. And but the distribution is relatively interesting because 55% of the screening is conducted in provinces, when in city only 30% of eligible people would go for screening program.
Segi, it's really impressive what you've been doing on screening in the country. The screening rate of 40% you mentioned nationwide must be a little bit disheartening because you've put all that effort in to have screening available and people are still not being screened. So what are your ambitions for improving that 40% rate in the next few years?
So the main ambition to increase the rate, screening rate, should be focused on advocacy and health literacy of the population. We have been running cancer screening programs for last 10 years, and the uptake rate is not increasing. It means that certainly we have to focus on encouraging people to go for screening programs, especially in the capital city.
Well, I think it's good that it's the capital city which is causing the issue at the moment, because at least you've got a captive audience, and hopefully working together with different partners, you can get the message across that people should take the opportunity to be screened if they have it available. And I was delighted to hear that the lodge that you've set up is 3,000 people, patients and cancer carers, to be able to use that. I know how successful that has been in other parts of the world, in Turkey, the USA, and others. It really is an important part of helping people through the cancer journey, isn't it? Because if they do travel a long way, then they have to stay somewhere. So how successful has your lodge been?
We work to support patients who undergo cancer treatment, as chemotherapy, radiotherapy, and some surgeries are not available in rural areas. Patients still have to travel to city for the treatment, and therefore we provide accommodation for the patients' carers from rural provinces who are undergoing cancer therapy in city through accommodating at the lodge. And the lodge was established 3 years ago, and over the last 3 years, we accommodated around 3,000 patients and carers. And these services were really vital during COVID-19 lockdown over the last 2 years. And I can say that collaborative work, government with civil society on advocacy, health literacy, provision of supportive services are really important and key activities.
Exactly. I mean, I think a lot of others actually benefited through that because obviously with COVID, people were concerned about being in hospital environments, and lodges are hopefully safe environments for them to be close to those who are undertaking cancer treatment and care.
Definitely, it was really important supportive service for the cancer patients. And we really identified that especially during COVID-19 lockdown, when everything was locked down and people couldn't hardly travel anywhere, the lodge was the only place where cancer patients and carers could stay. We had a lot of feedback from our patients and family members that it was really big support to overcome cancer during this really difficult journey.
Perhaps I could move on to another question, Segi. I know you mentioned earlier about the relationship between the government and civil society in your own organisation working together. And we at UICC promote the idea that to address cancer control, the full spectrum as you described it, it needs the engagement of all of community, engagement of the government, civil society, the general public, and also the private sector. So in terms of addressing the core drivers of the challenges you have for cancer in the country, do you feel that is working? Are there good examples of partnership, collaboration, which is really helping to address the factors which are causing those disparities in cancer care?
There is a need for more evidence-based, cost-effectiveness evaluated decisions, and government should engage civil societies and private sectors on this. I think that selection of certain types of cancer screening programs based on the evidence basis is important for many resource-limited settings, because setting up the screening program is quite expensive and it needs to be very scientifically based. And as Mongolia is the least densely populated country, providing equal access to quality cancer care, even to very remote areas, is very challenging. And that's why improvement of infrastructure, increasing the funding, continuous training of the health professionals, and retaining them, especially in rural areas, is very, very critical. And that's why private sector, civil society organizations can play a very important role in advocating for the funding, improving health education, conducting research to address issues around disparity.
I think the way that you're approaching it in Mongolia is an example to all of us, and hopefully we can use this podcast and also the great work that you do to inspire others to look at how you can, over a 10-15 year period, really transform the way in which cancer control, in fact NCD control, and the introduction of universal health coverage principles can make a difference to society. So Tsetse, I guess I sit here in Geneva admiring all the great work you've done. I'm delighted that you're part of the UIC family, and I really appreciate the efforts and energy that you put behind all of this. So thank you very much for giving us your time today, and I wish you the very best of luck, and hopefully we'll meet up again at a World Cancer Congress or a World Cancer Leaders Summit soon. So thank you very much for telling us about what's happening in Mongolia.
Thank you very much, Kerry. And it was also my really great pleasure to be invited in the podcast. So I really also look forward to meet you during World Cancer Congress in Geneva.
We'll see you there then. Have a lovely day.
Have a lovely day too. Thank you.
Thank you for listening to this episode of Let's Talk Cancer. If you like this podcast, please subscribe for more content every month, from tobacco control through other risk factors through to cancer treatment and care. If you want to know more about UIC's work, visit uic.org or follow us on social media. And if you want to meet more inspirational people like Tsetse, you should come to the World Cancer Congress in October in Geneva. I can assure you, you'll leave inspired. Talk with you again soon.